Greetings, I'm Dr. Neilanjan Nandi. I'm an academic IBDologist at the University of Pennsylvania, and I'm proud to be your Epicurator of the month. I'll be speaking on evolving applications of intestinal microbiota transplantation, aka stool transplants. Should be interesting, so I hope you tune in. In this video blog post, I'll be highlighting some nutritional pearls as they relate to patients who have inflammatory bowel disease or Crohn's and ulcerative colitis. As it turns out, about a third of our IBD patients actually have concomitant functional symptoms, such as irritable bowel syndrome, that may actually benefit from a diet such as the low FODMAP regimen. Turns out there's so much more to nutrition in IBD as well. Tip number 1, eat clean. This means that diets that are high in fruits and vegetables have been actually shown to reduce the risk of developing inflammatory bowel disease. This is in contrast to diets that are high in sugars, diets that are rich in emulsifiers or chemicals added to food to extend their shelf life, diets that are high in omega-6 fatty acids. These come in the form of fats or oils such as corn oil, sunflower oil, or even margarine, or processed meats, particularly red meats. These types of food groups have actually been associated with an increased risk of developing inflammatory bowel disease. Hence, eat clean. Now, if you have inflammatory bowel disease, what can we do then? Well, that leads us to tip number 2. Be proactive. When we take care of patients with IBD, we need to proactively assess for nutrient and vitamin deficiencies. The blog post goes into further detail about what those specifics are, but the most common are iron deficiency anemia, calcium and vitamin D, B12 and folate, which can happen depending on where your Crohn's is or from some of the medications that we take, and other nutrient deficiencies such as fat-soluble vitamins, vitamins A, D, E, and K, and even magnesium and zinc. Tip number 3, when you're flaring, beware and be prepared. When we start to flare, farthest thing from our mind is an appetite. So we have to focus on aggressive oral electrolyte solutions to hydrate ourselves, small, frequent high-caloric meals, and then when our appetite does return, there's a couple of tenets of what to eat and what not to eat that we should follow. Specifically, even if you're not dairy intolerant, we recommend avoiding dairy, especially if you have colonic disease, because the lactose sugar in the dairy gets fermented and leads to bloat and cramp. Similarly, avoiding sugar is recommended. This means high fructose corn syrup, sodas, or that Halloween candy left over from last year. These sugars are fermented in the gut and can lead to an overgrowth of the types of bacteria that contribute to more symptomatic bloat, gas, and other gastrointestinal distress. And then fiber. We certainly need fiber for a healthy gut, but during a flare, it's hard to tolerate. We have to understand the difference between soluble fiber and insoluble fiber. Soluble fiber is a type of fiber that binds water in the gut, but insoluble fiber draws water from the intestine into the gut, causing uncomfortable bloat and distress. How can we minimize insoluble fiber? Well, you can peel and strip off the skins off of fruit and vegetables, and you can also soften the pulp by steaming and boiling them as well. And also, you can avoid seeds and nuts temporarily during a flare. I hope these tips were insightful. I hope they help you in your clinical practice. Feel free to read the post for even more detail. And please reach out to me anytime on social. You can follow me, Dr. Neilanjan Nandi, at FitWitMD. Thank you so much.